Hello and welcome to Mental Health Mondays. In preparation for all of the holidays that are quickly approaching us, we have Miss Stillwater here, one of our community partners, that will be talking about alcohol use disorder. Miss Stillwater.
Hi, everyone. Thank you for having me. It's great to be here. So I am currently a doctoral practicum student at IVAT, or the Institute on Violence, Abuse, and Trauma, and I'll be doing a presentation today on alcohol use disorder. So just to kind of give a brief overview of sort of the definition of what alcohol use disorder looks like. So it is a chronic relapsing brain disorder, and it's characterized by an impaired ability to stop or control alcohol use despite adverse consequences. Addiction can be viewed as a complex, progressive pattern of behavior that can have a range of different components, including biological, psychological, and sociological components. In terms of the addiction aspect of it, that does consist of three main components, which are preoccupation, compulsion, and relapse. So I do have a brief video. I'll only be showing a little bit of it, just a better overview of sort of what alcohol use disorder looks like. If someone can let me know if my volume, if it works, hopefully it does, but let me know if everyone can hear it.
Alcohol use can be associated with various physical and emotional issues. The negative ramifications associated with alcohol use are related to the amount of alcohol that a person uses, not to the type of alcohol consumed. There are two main types of alcohol abuse: binge drinking and alcoholism. Binge drinking is the consumption of a significant amount of alcohol in a single time span, and is considered to be significantly more than one would normally consume in that time frame. Binge drinking behaviors typically begin in late adolescence or early adulthood, often when individuals are in college or university. Those who continue to binge drink are more likely to become heavy drinkers and to develop issues with alcohol abuse or alcohol use disorders. The formal criteria to objectively measure binge drinking episodes was put forth by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the National Institute of Alcohol Abuse and Alcoholism, NIAAA. This criteria consists of three main points: the consumption of 4 or more alcoholic drinks on the same occasion within 2 hours by females at least one day during the month. The consumption of 5 or more alcohol drinks on the same day within 2 hours by males at least one day a month. The consumption of alcohol in a single time frame that raises one's blood alcohol concentration to a level of 0.08 at least one day a month, estimated for most females and males as being the number of drinks listed above. Heavy alcohol users are considered to be individuals who binge drink 5 or more times during a month. Drinking like this raises the concentration of alcohol in the blood, as the body's vital organs are unable to clear out that much alcohol in such a short time span. As we have just discussed what binge drinking is, we should examine what alcoholism is. The Centers for Disease Control and Prevention, or CDC, outlines alcoholism as dependency on alcohol. Individuals with alcoholism, or alcohol use disorder, AUD, have a strong craving for alcohol. Often, they continue to drink even when doing so causes them physical or social problems. People like this may try to limit or stop drinking, but they may be unable to do so due to the cravings they feel and the drinking habits they have. Someone with alcoholism
So just a little bit of an overview as to sort of what alcohol use disorder might look like. And I'll be going into some of those points in this presentation as well. In terms of the DSM is sort of like the psychology Bible that we use to sort of diagnose individuals with different disorders. So in order for an individual, so this is what alcohol use disorder would look like in an individual. So a problematic pattern of alcohol use leading to clinically significant impairment or distress as manifested by at least two of the following. So an individual will need to meet two of these criteria within a 12-month period to meet the threshold for an alcohol use disorder diagnosis. So either alcohol is often taken in larger amounts or over a larger period that was intended. There's a persistent desire or unsuccessful efforts to cut down on alcohol use. A great deal of time is spent involved in activities where alcohol use is present. Craving or strong desire to urge to use alcohol. Recurrent alcohol use resulting in a failure to fulfill major role obligations, such as at work, school, or home. Continued alcohol use despite having persistent or recurrent social or interpersonal problems. Important social, occupational, or recreational activities. Recurrent alcohol use in situations where it could be physically hazardous. Alcohol use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that could be exacerbated by alcohol. So an individual, like I said, has to sort of meet two of those criteria in order to sort of warrant a potential diagnosis for alcohol use disorder. So some of the symptomology and presenting problems, what this might look like. So if someone's struggling with alcohol use, they're really unable to sort of limit that alcohol intake. They're spending a significant amount of time drinking or getting alcohol. Those strong cravings or urges to drink. They might give up on reduce social and work activities because that might lead to drinking behavior. So they're actually withdrawing from social environments. They might develop a tolerance. So if someone's drinking in large quantities consistently, that threshold's pretty high. So their tolerance will be quite high. And also continuing to drink even when facing consequences. So this could be seen in work. Relationships could be a big one. So if the consequences are great, I get that someone would still be exhibiting alcohol use despite the consequences. So that's very common to see. And also unsuccessful attempts to quit, so these are some of the sort of presenting problems we see with someone who might have alcohol use disorder or alcohol use problems. So I am my practicum at IVAT. So we do look at sort of the forensic implications of alcohol use disorder. So alcohol and crime do have an interconnected relationship. So alcohol specifically can increase the likelihood of public intoxication and driving under the influence. It can increase the likelihood of assault or homicide due to that increase in sort of the agitation and anger. Being a victim of alcohol-related crimes, such as child or sexual abuse, makes it much more likely that someone could develop an alcohol use disorder. So I thought we really look at sort of trauma as one of our main sort of components that we look at. And so we have a lot of people with past histories of child sexual abuse. So this is really important to consider when looking at if someone has a dependency on alcohol. It could be like a coping mechanism for that trauma. And alcohol can also significantly impact judgment and cognition. So it really impacts that prefrontal cortex, that decision-making element in our brain, and can impact the decisions we make and sort of those consequences. And so some of the current crimes that are related to alcohol use, I mentioned a couple, but DUIs are quite prevalent. Crimes that are related to alcohol use, minors in possession, so minors under the age that are in possession of alcohol in public areas, public intoxication, open container, and then, as I sort of mentioned, assault, intimate partner violence, child abuse and neglect, homicide, and sexual assault. So those are all sorts of crimes that are related to this alcohol component. And we see with an alcohol use disorder, there actually is quite a large comorbidity. So someone who's suffering from alcohol use disorder might also present with bipolar disorder. They might present with schizophrenia, antisocial personality disorder, and anxiety and depressive disorders. So those depressive disorders might be attributed to some of the acute effects of intoxication or withdrawal. We also see comorbidity in terms of these sort of physical symptoms, these somatic disorders. So we see individuals have higher rates of GI bleeding, damage to brain cells, so it can impact cognition, intellect, dementia, high blood pressure, pancreatitis, and nerve damage. And so repeated alcohol intoxication can actually suppress the immune system, and it can increase an individual's chance of developing an infection or cancer later on in life. So these are just some of the comorbidities, both physical and mental, that we see within sort of alcohol use. In terms of some of the contextual and risk factors, so regarding environmental factors, so this might look like cultural attitudes towards drinking and intoxication, personal experiences with alcohol, and levels of stress. So someone has a very high stress level or a very stressful job, they might be more inclined to resort to alcohol use to sort of combat that stress. Also, peer support and positive expectations of alcohol effects can contribute to this disorder as well. So we see a lot of sort of peer pressure to drink in a lot of social situations. So this could potentially result in the development of an alcohol use disorder. We also see different culture, as I mentioned, kind of that cultural attitudes, and also the genetic and physiological factors. So when looking at alcohol use disorder from a genetic standpoint, so biological, we're seeing that about 40 to 60% of the variance of risk can be attributed to a genetic component. So children that actually have an increased chance of getting alcohol use disorder if their parents have it. And this is the case even if the child was raised by adopted parents. So that's what we're seeing sort of in the research in this area of literature. So that's really important to understand when looking at that sort of nature versus nurture element. So alcohol use disorder can be significantly impacted by that social factor as well. In terms of gender, so statistically, males drink at higher rates compared to females. However, so due to that, the body composition in women, they're actually more likely to develop higher blood alcohol levels per consumption compared to men. Females who are heavy drinkers are at greater risk of developing physical consequences as a result of alcohol use. And additionally, so we see sort of the stigma associated with women drinking as well. So particularly when it comes to rape accusations and sexual assaults. So women who are alcoholics or have alcohol use disorder are more likely to be victims of violent crime. And those who perpetrate are actually less blamed than the victims themselves. So that's what we're sort of seeing in the literature. In terms of some of the risk factors, so this looks like, so as it was kind of mentioned in the video briefly, but so more than 15 drinks per week for males and more than 12 drinks per week for females, and more than 5 drinks per day at least once a week, which is known as binge drinking. So if someone's drinking more than 15, so if they're men and they're drinking more than 15 drinks per week, that's a risk factor for developing alcohol use disorder. And then for females, it's 12 drinks per week. Something important to kind of consider. And we also, so in terms of this consumption of other drugs aspect, so we typically see people with alcohol use disorder present with problems with other drugs, such as cannabis or cocaine. Alcohol can actually be used to relieve unwanted or adverse effects of these other substances, or subsequently substitute for them when they're not available for consumption. And then this racism, discrimination, and prejudice piece is really important to consider when looking at alcohol use. So people who actually identify with the LGBTQIA community, so they might be more at risk, for instance, in developing alcohol use disorder due to higher levels of discrimination. So individuals who reported discrimination based on race, gender, and sexual orientation were almost 4 times more likely to use alcohol and other substances compared to others. So that's just sort of something really important to keep in mind when we're looking at someone's alcohol use over time. And so within sort of our field within psychology, it's really important to consider these cultural aspects when working with clients that are presenting with a range of different symptoms, but with alcohol use disorder, it's quite significant. And so when we're looking at sort of worldwide, so 3.8% of deaths can actually be attributed to alcohol use disorder. 80% of adults in the US have consumed alcohol at some point, and 65% have a current alcohol use disorder. So that's more than half. When we look at the lowest prevalence with alcohol use disorder, so only about 1.1% of the population in the African regions have alcohol use disorder or meet the criteria for alcohol use disorder, I should say. In the American region, it's about 5.2%. And then Eastern Europe, there's about a prevalence of 10.9%. And this diagnostic criteria of alcohol use disorder actually performs quite well when we're looking at different racial and ethnic groups. The actual threshold to meet this sort of alcohol use disorder, it's quite consistent throughout cultures, throughout racial ethnic groups. And across like race and ethnicity, so African Americans and Latinos tend to have more conservative attitudes towards drinking compared to Americans. And these more conservative attitudes might actually be associated with lower drinking frequency. Immigration is also another important factor to consider. So immigrants might be at risk of developing alcohol use disorder because of the hardships they encounter when coming to the United States. So that's sort of additional stressor that they're facing. This is just kind of a brief. This is a tool called the Mast, which is sort of it's kind of like the standard questionnaire to use with someone who presents with either issues with alcohol or concerns around alcohol. So this test is self-administered, and it's used to identify mild, moderate, or severe alcohol use disorder. So the test uses yes or no questions to determine any alcohol-related behavior. So how it's sort of scored, I'll just kind of give a very, very brief overview. So you get 1 point if you answered no to either questions 1 or 4, and you score 1 point if you answered yes to either questions 2, 3, or 5 through 22. And it's kind of hard to see, but this is kind of a brief sort of glance at it. And if anyone scores about a 6 or above, that signifies severe problems with alcohol misuse, and that would require further evaluation by a healthcare professional. So when looking at some of the evidence-based treatments for alcohol use disorder, so we're seeing pharmacological or sort of the medicinal interventions, behavioral therapeutic interventions, detox is a very common one, and rehabilitation centers. I'll go into a little bit more detail about each of these 4. So I won't be able to pronounce the names for most of these there, but these are some of the medications that individuals might be on to sort of combat cravings for alcohol. So for instance, disulfiram, naltrexone, and caprosate. So that one actually reduces cravings for alcohol. Naltrexone attempts to reduce alcohol cravings as well. And there are newer developments still under investigation. So calcium carbamide, GABA metabolites, and mood stabilizers. Those are in sort of the up and coming area. So a lot of development is still being done around these areas to sort of see how this could impact someone with alcohol problems. In terms of behavioral, so behavioral couples therapy is a very effective intervention for individuals or families where alcohol use is prevalent. So this sort of therapy uses behavioral principles to perpetuate abstinence. So this therapy has actually been found to increase abstinence, improve relationships, and decrease domestic violence in families. In terms of these brief interventions, so this is used primarily in like primary care practices. So this consists of screenings, assessments, advice, and more follow-up visits to sort of manage alcohol use. Cognitive behavioral therapy, this is a very widely used one. So this helps patients develop new cognitions or thoughts and coping strategies for substance misuse behaviors. And it has been found to reduce alcohol use significantly. In terms of contingency management, so this basically reinforces abstinence through like tangible goods or money in exchange for treatment compliance. So someone might be rewarded for not drinking alcohol, to sort of try to change that behavior and sort of increase and improve upon these sort of more positive behaviors. In terms of motivational enhancement therapy, so this uses motivational interviewing through those steps of change model. So within the psychology field, we have this sort of the 5 stages of change, anywhere from pre-contemplation all the way through to relapse. So looking at where an individual is in that sort of cycle of change, and using motivational interviewing to help someone sort of stay motivated to remain abstinent from alcohol if they're struggling with an alcohol use disorder. The 12-step facilitation therapy. So this is what we see typically in AA groups, Alcoholics Anonymous. So it's sort of those 12-step tools towards abstinence is very key in those specific programs. And this, so psychotherapy and pharmacotherapy. So across the literature, we're seeing that when these two are used in conjunction with one another to address individual problems and preferences, that's where it's the most effective. So having medication in conjunction with therapy is really sort of significant and helping to work with an individual with alcohol use disorder and reducing those cravings and ultimately remaining abstinent from alcohol use. Another one of these sort of areas of interventions are detox programs. So an individual who goes to a detox facility or detox program, they might learn skills and establish a treatment plan. This usually involves alcohol treatment specialists, and that might include goal setting, in addition to like behavior change therapies, self-help, and counseling. So really working on sort of cultivating these skills to use in the community when they're not in this specific facility. So really trying to incorporate these skills into everyday life. And then rehabilitation centers. So those are instrumental in helping combat addiction. So for those deemed suitable for detoxification or residential drug treatment services, so rehabs would be a very appropriate intervention for them. The only thing with rehabilitation centers is individuals could be excluded due to certain criteria, such as exhibiting dangerous behavior or requiring immediate medical treatment. So rehabilitation centers are unfortunately not available to sort of everyone, but they are a very good intervention for someone that's struggling with alcohol use or alcohol use disorder. So that is all I have. So if there's any questions or comments, happy to take those. I'll stop sharing too.
Excellent. Thank you so much. And we will take any questions or concerns or comments offline. And as a reminder, please be sure to check out our website because it'll also have additional links and resources that was shared today. Thank you and have a great rest of your day.